السلام عليكم ورحمة الله ومرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 2 in Pediatric Nursing. Today we are going to discuss 5 questions from question number 159 up to question number 163. معكم محمد عثمان يحيى. نبدأ مباشرة. Question number 159. A topical corticosteroid is prescribed by the healthcare provider for a child with atopic dermatitis, eczema. Which instruction should the nurse give the parent about applying the cream? The options are: number A, apply the cream over the entire body. Number B, apply a thick layer of cream to affected areas only. Number C, avoid cleaning the area before application of the cream. Number D, apply a thin layer of cream and rub it into the area thoroughly. وقف الفيديو هنا واختار الخيار اللي بتشوفه الصحيح. The correct option is option number D. Apply a thin layer of cream and rub it into the area thoroughly. ليه اخترنا الخيار رقم دي؟ نشوف rational. Atopic dermatitis is a superficial inflammatory process involving primarily the epidermis. A topical corticosteroid should be applied sparingly or thin layer and rub it into the area thoroughly. So the correct option is option number D. Apply a thin layer of cream and rub it into the area thoroughly. And option number B is incorrect because of a thick layer of the cream. The affected area should be cleaned gently before application, so option number C is incorrect. And a topical corticosteroid should not be applied over extensive area because systematic absorption may occur with extensive application. So the option number A is incorrect also. Question number 160. The school nurse is performing pediculosis cavities or head lice assessment. Which assessment finding indicates that a child has a positive head check? The options are: number A, maculopapular lesions behind the ears. Number B, lesions in the scalp that extend to the hairline or neck. Number C, white flaky particles throughout the entire scalp region. Number D, white sacs attached to the hair shafts in the occipital area. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number D. White sacs attached to the hair shafts in the occipital area. اللي اخترنا الخيار رقم دي نشوف rational. Pediculosis cavities is an infestation of the hair and scalp with lice. The nets are visible and attached firmly to the hair shaft near the scalp, and the occipitus is an area in which nets can be seen. So the correct option is option number D. White sacs attached to the hair shafts in the occipital area. Maculopapular lesions behind the ears or lesions that extended to the hairline or neck are indicative of an infectious process, not pediculosis. And white flaky particles are indicative of dandruff. So the correct option is option number D. Question number 161. The nurse caring for a child who sustained a burn injury plans care based on which pediatric consideration associated with this injury? The options are: number A, scarring is less severe in a child than in an adult. Number B, an immature immune system presents an increased risk of infection for infant and young children. Number C, fluid resuscitation is unnecessary unless the burned area is more than 25% of total body surface area. Number D, the lower proportions of body fluid to body mass in child increase the risk of cardiovascular problems. وقف الفيديو هنا واختار الخيار بالشوف الصحيح. The correct option is option number B. An immature immune system presents an increased risk of infection for infant and young children. اللي اخترنا الخيار رقم بي نشوف rational. Pediatric considerations in the care of a burn victim include the following. Number 1, scarring is more severe in children than in adults. Number 2, a delay in growth may occur after burn injury. Number 3, an immature immune system presents an increased risk of infection for infant and young children. Number 4, the higher proportion of body fluid to body mass in a child increase the risk of cardiovascular problems. Number 5, burns involving more than 10% of total body surface area require some form of fluid resuscitation. Number 6, infant and young children are at increased risk for protein and colorless deficiencies because they have smaller muscles mass and less body fat than adults. So the correct option is option number B. An immature immune system presents an increased risk of infection for infant and young children. Question number 162. The nurse analyzes the laboratory results of a child with hemophilia. The nurse understands that which result will most likely be abnormal in this child. The options are number A, platelet count, number B, hematocrit level, number C, hemoglobin level, number D, partial thromboplastin time. وقف الفيديو هنا واختار الخيار اللي بشوفه صحيح. The correct option is option number D, partial thromboplastin time. اللي اخترنا الخيار رقم دي نشوف rational. Hemophilia refers to a group of bleeding disorders resulting from a deficiency of specific coagulation proteins. The platelet count and hemoglobin level and hematocrit level are normal in hemophilia, but result of tests that measure clotting factor function may be abnormal. So the correct option is option number D, partial thromboplastin time. Abnormal laboratory results in hemophilia indicate a prolonged partial thromboplastin time. Question number 163. The nurse is providing home care instructions to the parents of a 10-year-old child with hemophilia. Which sport activity should the nurse suggest for this child? The options are number A, soccer, number B, basketball, number C, swimming, number D, field hockey. وقف الفيديو هنا واختار الخيار بشوف صحيح. The correct option is option number C, swimming. اللي اخترنا الخيار رقم C نشوف rational. Hemophilia refers to a group of bleeding disorder resulting from deficiency of a specific coagulation protein. Children with hemophilia need to avoid contact sport and to take precautions such as wearing elbow and knee pads and helmets with other sport. So, swimming is safest sport for them. The correct option is option number C, swimming. Option number A, B, and D are incorrect. because these activities are comparable or alike متشابهان in that they present the patient for injury. So the correct option is option number C. شكرا جزيلا، نتقابل في محاضرة جديدة. Don't forget to support us by comment or like or subscribe.